Imagine an older man standing up from his living room chair. The room suddenly spins violently around his head. He loses his balance and collapses onto the hard floor. He fractures his hip and is rushed to the hospital. The emergency doctors run a series of comprehensive tests. They discover he did not suffer from a sudden stroke. He simply took his standard morning blood pressure pill. His blood pressure was exactly 120/80. This exact catastrophic scenario happens thousands of times every day. Chasing this universal biological number is actively destroying senior health. The medical establishment has sold you a dangerous oversimplification. Our clinical medical board reviews raw data every single day. We ignore outdated medical dogmas and generalized pharmaceutical marketing. We focus entirely on peer-reviewed, objective biological truth. You need raw clinical data to protect your future health. I invite you to subscribe to this educational channel today. Join our exclusive community of dedicated biological truth seekers. Let us decode exactly how your vascular plumbing actually works. Think of your cardiovascular system as a very tall building. Your heart is the powerful water pump in the basement. Your blood vessels are the pipes running vertically upward. Your brain is the vital penthouse suite on the top floor. When you are 20 years old, your biological pipes are flexible. The basement pump easily sends rich blood to the penthouse. A pressure of 120/80 works perfectly here. The fluid reaches the top floor without any mechanical struggle. But human biology fundamentally changes as we naturally age. By age 70, your vascular pipes become stiff and rigid. They accumulate calcium deposits and lose their youthful elasticity. This biological process is known as arteriosclerosis. Pushing fluid through stiff pipes requires significantly more mechanical force. The basement pump must push much harder to reach the penthouse. Your systolic blood pressure naturally rises to compensate for this stiffness. Your body is intelligently ensuring the top floor gets enough oxygen. This biological adaptation brings us to a massive and dangerous trap. Modern medicine rigidly insists everyone must hit 120/80. Doctors prescribe heavy medications to aggressively force the pressure down. They artificially weaken the basement water pump with beta blockers. They drain the fluid volume using strong diuretic pills. The blood pressure monitor suddenly looks absolutely perfect on paper. The doctor smiles and tells you the treatment is highly successful. But the blood is no longer reaching the penthouse suite. Your brain tissue is suddenly starving for critical oxygen and nutrients. This oxygen starvation is why seniors feel dizzy upon standing. The clinical medical term for this is orthostatic hypotension. It directly leads to devastating falls and permanent mobility loss. It also silently accelerates irreversible cognitive decline and dementia. Your brain requires a specific minimum pressure to function properly. Artificially low pressure also destroys your fragile kidney filters. Your kidneys require strong, continuous blood flow to clean your blood. Forcing the pressure too low causes severe acute kidney injury. The 120/80 target is a dangerous biological myth. It is a generalized average that ignores individual aging biology. The famous SPRINT clinical trial misled millions of patients and doctors. It tested intensive blood pressure lowering in very specific populations, but it excluded patients with severe frailty and nursing home residents. Applying those results to vulnerable seniors is a massive clinical error. Major medical organizations are finally acknowledging this biological reality. The American College of Physicians released updated clinical guidance recently. They recommend a systolic target of 150 for older adults. Other major clinical guidelines suggest 130 or 140. The perfect clinical number depends entirely on your personal biological frailty. You must discard the myth of a universal biological target. The actual clinical protocol requires highly personalized daily metric tracking. You must start tracking your positional blood pressure every single day. Take your pressure while sitting quietly for 5 full minutes. Then stand up and immediately take the reading again. If your top number drops by 20 points, you are in danger. You are highly overmedicated and risking a fatal fall today. You must also regularly test your kidney function blood markers. Ask your physician to measure your estimated glomerular filtration rate. Monitor your blood urea nitrogen and serum creatinine levels closely. These specific blood metrics reveal if your internal pressure is adequate. If your creatinine rises, your kidneys are likely starving for blood. You must carefully track your cognitive function and daily energy levels. Extreme fatigue is a symptom of systemic oxygen deprivation. Never accept 120/80 as a blind medical goal. You must carefully discuss these personalized targets with your physician. Ask them directly if they are treating the monitor or the patient. Remind them that rigid aging arteries require much higher perfusion pressure. A blood pressure of 140 might be your ideal biological state. Do not alter your prescribed medications without strict medical supervision. Sudden changes to cardiovascular medications can trigger severe rebound effects. We will continue to review the peer-reviewed clinical data daily. Protect your cardiovascular health and stay perfectly objective at all times. Thank you for seeking the biological truth with our medical community today.